community benefit as it was intended by all of the wonderful donors that we have had. So with that, I'm going to turn it over to Dr. John Mugen, who is going to give us an update, and then we will have time for questions and answers. Thank you. John?
Thanks, Josh. Good afternoon, everyone. Thank you for joining. I'm Dr. John Mugen, Physician Executive of Quality and Safety for Northern Arizona Healthcare, and I'd like to share some information about COVID-19 and the variants that we're seeing currently. Unfortunately, COVID-19 infections have not gone away as we had hoped, and as many of you are aware, we're seeing a spike in cases with some very highly infectious variants. The most predominant SARS-CoV-2 mutation affecting the regions of the US, including Arizona, is the B1.617.2 variant, also known as the Delta variant. It's making up the most of our cases now. Early data suggests that the Delta virus or Delta variant of the virus is 200% to 250% more transmissible and may lead to much higher, up to 1,000 times higher viral loads than the previous COVID-19 viruses. So what that means is a single person with Delta variant infection could infect as many as 6 to 10 others. This is compared to 2 to 3 others estimated with the original strain of COVID-19. So this compares to chickenpox as far as the contagiousness of this new Delta variant. And we're seeing that it's particularly a risk for unvaccinated individuals. Those that are unvaccinated and are infected with the Delta variant have an 85% higher risk of requiring hospitalization compared to those that have received a full course of COVID-19 vaccination. So it's important to also emphasize that a vaccinated person can still become infected, and those vaccinated individuals may have few or not even any symptoms when they become infected, and that can lead to the spreading the virus to others. That being said, the vaccine is doing its job, and we've seen hugely reduced severe infections, hospitalizations, and deaths amongst that vaccinated population, both nationally and locally. And this is really how the surge is different this time around. This time we have a great tool at our disposal to reduce hospitalization and death, and that's the COVID-19 vaccine. So improving COVID-19 vaccination rates is the most important thing we can do now to protect our communities and ourselves. I highly recommend it for those that are considering the vaccine and for anyone who has not received it. It is readily available and it's free. Many students are also heading back to the classroom, and so we have to be wise about our approach to this. Many of the same recommendations that we shared earlier in the pandemic still are important. So staying home if you're sick, washing your hands, distancing when you're able to, avoiding large crowds, and masking indoors are some of the simple things that can reduce the spread of COVID-19 virus. NEH is still following CDC guidelines, and at this time, the CDC is recommending masks for all persons in indoor areas where COVID-19 numbers are high, and we're seeing high community spread currently. And this includes both vaccinated and unvaccinated individuals, and is particularly important in public spaces, particularly in crowds or where you can't distance. Masking for all employees and patients remains in place at NEH facilities. And I feel that if people are mindful of masking and distancing in shared indoor spaces, we can do what we can to prevent the spread of this virus. Another important note is, as of last week, Arizona was ranking 7th highest in the nation of new reported cases. So let's do what we can to reduce this. Thank you very much. I'm going to turn it over to Dr. Derek Fique. Derek?
Hey everyone, I'm Derek Fique. I'm Chief Medical Officer for NIH. Give you a little bit of update about what's going on in our facilities today. As of this morning, Flagstaff Medical Center had 24 positive COVIDs in-house. Sometimes that can be a little misleading because, like Dr. Mugen said, we test everybody that comes into the hospital. And so I personally had a couple of patients last week that were positive that had 0 symptoms, and they were just here for another reason. But 24 is still the highest number we've seen in this wave of COVID. We have a census of 204, so you can see it's a reasonable number of our patients, about 1/8 of the patients in the hospital right now. We currently have 7 patients on ventilators, but those aren't necessarily COVID patients. Those are just patients in our hospital that are on ventilators, and it's actually kind of a low number for here. At Cottonwood or in Verde Valley Medical Center, we have 13 positive COVID patients. Their census is 63, so a little bit larger percentage of the number of people in the hospital there. They have no patients on ventilators at this time, and not a very busy ICU at the moment, about half full. So we're starting to see a pickup again, much like we did in the past. Hopefully it won't be as bad given the fact that we have about a 50% vaccination rate. And I'll just echo what both Josh and John said, that we need to keep getting people vaccinated. That's going to be the biggest thing here. Masking and distancing are important as well, but the vaccine is really the key to this, and getting people educated, getting people out there to do it. So one more thing to address. There was a rumor going around that we had something like 17 people in our ICU that were vaccinated, but here for COVID and here battling COVID infection as their primary reason for being admitted to the hospital. That's not true. I will say I have seen COVID patients who have been vaccinated, but they have been in the hospital and only tested positive for COVID anecdotally, meaning that they didn't even know they had the infection. We checked them and found it. They were completely asymptomatic. They had been vaccinated prior. So just like Dr. Nugent said earlier, that certainly is possible. Those people could still be considered contagious, but the ones I've seen have not been symptomatic in any way. So with that, let's open it up for questions. It looks like all of us spoke, but all the questions are for Tiffany.
Thanks, Dr. Fuqua. Cameron, you asked a great question about staffing, specifically about nurse staffing and our ICU staffing. Staffing remains a challenge across our organization, not just for nurses, but for our other disciplines as well. We've been fortunate about being able to utilize travel nurses and being able to secure them. We are far from staffed to appropriate. However, we've been able to remain consistent with our staffing ratios, especially for our ICU. Our ICU specifically is our most well-staffed unit at this time. And I think that's because we've had great focus since our first spike in cases to now, to ensuring that we did not have a gap with that nursing staff. So you can rest assured our ICU is our most well-staffed of all of our departments at this time. Ryan asks a question about, it reads, how exactly will visitation policies change on August 11th? That's a great question, Ryan. As an organization, we've put together visitation criteria that matches community spread. So if you went to our portal, you would be able to see what our visitation restrictions are in the time of substantial transmission as well as high transmission. So on August 11th, we will be going to high transmission visitation restrictions, which has an impact on most areas of the organization, meaning it has an impact on how we manage visitation for our pediatric and our labor and delivery patients, as well as our end-of-life patients and our ED patients, our surgical service patients. The important piece to note is that will remain up to date at all times on the portal. So I think the safest way to answer that question is to refer folks to the portal, knowing that on August 11th, we will be in high transmission spread, and our criteria and restrictions will match that.
All right, looks like Dave is asking, are you seeing kids? Oh, it popped up. Are you seeing kids being admitted with this surge like other parts of the country are? Yes, we have had a few children admitted to the hospital. All have done well to this point, to my knowledge. So it's also, I mean, if you have kids that are 12 and up, they can get vaccinated. People have asked me this question, I'll say it here. We got my 12-year-old son vaccinated. There was no hesitation in doing that whatsoever. He got through it like a champ without hardly any issue at all. In fact, I think he was just faking not feeling well to not have to do any work. And if we could get the other two vaccinated, we certainly would, but they're too young to do so. But we have seen that. But like I said, 12 and up, get them vaccinated.
I'll take a couple. Cameron asks, how frustrating is it to have to debunk rumors like vaccinated people filling up the ICUs? I don't know as it's frustrating, but it does take a good amount of our time, and we're trying to get as much good information and accurate information out to our communities. Much like the Valley View Care rumor that we're going to sell the building. We just ask for you guys in the media and all of our community, if you're hearing something and it doesn't sound right, reach out and ask. You can always email questions@nahealth.com. We're pretty good about getting back to those and within 24 to 48 business hours. So I don't know, it's frustrating as much as it just takes more time away from the other things that we should be doing. And then conference room asked, what's the vaccination policy for your workforce, nurses, doctors, et cetera? So we have not made a determination on our vaccination policy yet as it relates to COVID-19. It's something that we're discussing, but we have not made a decision internally whether or not we would mandate vaccination, and if we did, what that would look like. So probably more to come on that in the future, whether we decide to do that or not.
All right, so I'll grab a couple here. I've got one from Stephanie, and there she is. Are most of the patients hospitalized and sick with COVID-19 and NIH unvaccinated? And you know their general age range? Yeah, so by far, most are unvaccinated. And like I said, the ones that I've seen that are vaccinated, it's only been a coincidence that we found out that they had it because we test everybody that walks through the door and gets admitted vaccinated or not. So vast majority have not been vaccinated. The other question, in the age range, yeah, we're seeing big age range, I'll say younger this time, but I think that's because a very large percentage of the older population got vaccinated. And like I said, the patients that I've seen that have been vaccinated and still tested positive that weren't symptomatic were older. So the older population in Arizona got after it. I don't want to give the exact percentages, but I think I want to say it's somewhere like 85%. And I might be wrong about that, but I know it's quite high as far as those that went out and got vaccinated. So yeah, the unvaccinated are the ones that we're seeing in the hospital. So we are seeing a little more younger people this time as well, and that partly might have to do with the virulence of the Delta variant. Can patients find out if a doctor or nurse has been vaccinated before treating or going into surgery? Is that public information? So that's not public information, but you can always ask. I don't know any physicians here at NIH that aren't vaccinated, but I also don't know that if there are, they'd be advertising that, because I think the peer pressure from the rest of their colleagues would be pretty rough at this point. However, you're completely within your rights to ask that question. And as a physician, I think your duty is to be honest with your patient about something like that.
Cameron asked a question. Oh, go ahead.
You kind of covered Terry's question too, so it was similar to the previous, so I'll skip that.
So then someone says, can you talk about worker burnout as we potentially face another surge? Certainly, stress is a key contributor to worker fatigue and burnout. I think, and Tiff, I'd love for you to comment and chime in on this. I feel like people are in pretty good spirits in terms of it's not necessarily COVID. I think a big stressor for us is the amount of staff that we're able to find. We've talked about it on other previous media briefings. What happened was a lot of nurses nurses, techs, office coordinators, you name it, moved to either be closer to family or friends, or they are traveling to do work. And that certainly has put more stress on staff that live locally in our communities and are providing the tremendous care that everyone experiences. But I don't know as the burnout is directly related to COVID resurgence, more just the amount of workload that we have to do with the staff we have. Tiff, anything you'd add?
That's well said, Josh. In addition, I would add the resources that NIH has put in place to help support our colleagues. We have amazing health coaches as part of our workforce that helps to facilitate working through moral distress and burnout of our staff, as well as a very strong ethics committee that's in place to provide additional resources for our staff. I would agree it's impacting the staff, the state of the world, not just the state of COVID at NIH, but we have put into place some pretty phenomenal resources that we're able to provide to our frontline folks.
So I'll grab a couple here. Ryan asks, how does this surge compare to previous spikes? Are you seeing more extreme cases in general? So in comparison to previous spikes, numbers are lower this time thus far. Hopefully they remain that way, and hopefully that's because a lot of people are vaccinated. As far as extreme cases, I will say NIH saw the worst period of extreme cases resulting in deaths in early April, May of the whole pandemic in 2020, where we were just learning how to treat this across the country, and we put people on ventilators earlier than we did later and saw a lot of people pass early then. And then, of course, in January, it was really bad of 2021. So I'm not necessarily seeing cases that are more extreme. We're still treating it roughly the same way. We've gotten a little bit better and have a few new tricks up our sleeve than we did before. But we're still seeing patients, that come in that are unvaccinated, that get hospitalized and end up getting some pretty bad lung infection and end up in the hospital for 2 weeks or longer. So that's still going on. I've seen plenty of people like that. But we're also seeing the patients that come in and stay for 2 or 3 days and get to go home before they even need to complete the total course of some of their medications. So we're still seeing the same kind of stuff. And Krista asks, are you seeing COVID patients from the nearby Native communities? Yeah, absolutely. We're always taking care of our friends out from the reservation in northeastern Arizona. However, I will say they did a fantastic job of getting vaccinated. They got hit so hard in April, May of 2020 that those communities really got their heads around the importance of vaccination. The healthcare system out there did a wonderful job getting people vaccinated. So while we're seeing people from the reservation, it's not nearly in the numbers percentage-wise that we saw early in the pandemic. So it's much better now.
Definitely.
And kudos to those communities.
I'll take a question from conference room. What happened to all the patients that were going to the hospice facility in Cottonwood? There were 55 patients between January 1, 21 and the closure in April, according to Dr. Mickey's. I don't know. I'm not familiar with Dr. Mickey's. As we've talked before, first and foremost, we did not have a hospice facility. Valley View Care is not a hospice facility. Valley View Care is an assisted living facility that was strictly specializing in end-of-life care provided by home hospice companies. So it's a pretty important distinction as we talk about hospice facilities versus assisted living facilities. I don't have the exact numbers between January and April, but what happened in April is we went to a census of 0. There's lots of theories of what that is and why that is. One is we were just talking about visitor restrictions. So not as many family members could visit dying loved ones in the facility. And as we're seeing, we're going to have to be ramping those back up. So there is some thought that people chose different avenues for their death and dying process, whether that be at home, which is a trending thing across the country as more people are dying at home in the care of their loved ones, and or they're already in other facilities. So one of the important delineations between your kind of end of life choices is you really have 3 major areas that you can choose for your end of life services. So one would be a true hospice facility, which we do not have in the Verde Valley anywhere, which is they're dedicated just to providing hospice care on a GIP or inpatient level service. The second one would be having hospice in your own home, or the third, if you're in assisted living or skilled nursing facility, accessing your hospice benefit from a home health or hospice provider. And so as we looked at that facility for Northern Arizona Healthcare and the communities that we serve, we want to make sure that we're getting the best utilization out of that facility. We're typically between 50 and 60% occupancy of that facility, which means only about half of the beds wherever had a patient in them. And we would like to see where we can use that beautiful facility at more of a 70 to 80, 90% occupancy rate. So that's what we're working on right now. But I'd be happy to talk to Dr. Mickey's if he or she would want to reach out.
And I'll take a question from the conference room. How close is the Verde Valley Medical Center to having to shut off elective surgeries? Do you think this will get worse? Do I think COVID will get worse in this surge? Probably. It seems to be going up and we haven't really plateaued yet, so I bet it will. Now, as far as elective surgeries at Verde Valley Medical Center, we're doing fine right now. If for any reason we were to have to shut off elective surgeries at the moment, it would be more of an issue related to staffing than it would be related to COVID. I would suspect that we would probably treat that the same across our system, depending on how things were at each facility. If it were a COVID issue, which it is not yet and is not close to that. If it were a staffing issue, that would be different. But right now we're still doing fine. But we're not in a situation where COVID is going to shut down surgeries at elective surgeries at our facilities at this time.
So we are out of questions in the queue at the moment. If you've got other questions or things that you'd like to hear about, please add them now.
Hi, everybody. This is Janine Jones-Verse, Chief Communications and Marketing Officer. Just wanted to affirm per Tiffany, Dr. Fuqua, and Josh today, Dr. Mujan as well. We will be sending out those visitation guidelines and policies to each of you in an official release after this call. So you'll have all that information. And as was shared, you can go to the website to get more information as we make any further changes and updates. Thank you.
So the question is from Ryan, where are the majority of COVID cases coming from currently? Is Flagstaff the main source of the cases? So as far as total cases and positivity, Coconino County, Flagstaff is contributing the highest to that. We have increases in every community. So if you look at Page, the tribal communities, they are going up, but not as fast as Flagstaff. So I would say Flagstaff is the main contributor currently.
Chris, thank you for your question. Chris writes, with how busy healthcare workers continue to be, if the public wants to send well wishes, cards, letters, etc., what would be the best avenue for that response? I'm going to let Janine Jones answer the specifics of that. I just want to share how meaningful and how impactful those cards and letters are when we do receive them. We've taken entire hallways and entire walls of units to fill with those inspirational letters and those thank yous, and it is incredibly meaningful to our staff. So I can't tell you exactly how to do it. Again, I'm going to let Janine do that, but I will say, please encourage that. It means a lot to our staff, and we're incredibly grateful when we do receive those.
Yeah, thank you so much, Tiff. I really appreciate that ask from you. And yes, it does mean a lot. The staff, all of our colleagues, just their hearts are so warmed to receive that. And we started to experience that obviously last year in the height of COVID, and it still continues today. So many of you may have contact information for our population health team. That is the group that has been receiving those letters and those cards. I would share that if you have anything that would be a special request, that you reach out to the communications team, and that's communications@nahealth.com. And we would be able to coordinate with you if it's a stack of letters or cards or anything like that. But I will make sure in our communication back to you, we get you the right contact with Pop Health so that you can get that information and have that and share it with the community. And we'll continue to push that out as well. It's a very good point. Thank you for that.
So Dave says, what is the latest about possibility of those vaccinated spreading COVID if they don't wear a mask? This is where the whole mask thing gets really tough. So I hate wearing a mask. I don't think anyone on this phone call likes wearing a mask. My kids don't like wearing a mask. It's terrible, but it is what it is. And until we can really get everybody vaccinated, or a really large number of people vaccinated, this is the real issue, right? So if I'm vaccinated and I get COVID and I don't know I have it, and I'm going out and I'm laughing and joking and doing all this stuff and yelling and whatever, yeah, I can totally spread it to other people completely. The mask is more about me not giving it to someone else than necessarily protecting you from getting it from me. So if you got COVID, wearing the mask is the big deal. And the problem you might run into is there could be plenty of people that are vaccinated that don't know that they have it, that could potentially be spreading it, especially to family members who aren't vaccinated or too young to be vaccinated or immunocompromised or what have you. So this is, once again, back to the issue of how important it is for more and more people to get vaccinated. Because if you have been vaccinated and you're completely asymptomatic and you're out spreading it, you wouldn't know. So it's John, does that make sense? Would you agree with that?
No, well said. Yep. And that's why CDC has kind of changed their recommendations around masking for those that have received vaccine. Not so much that they're worried about them getting severe illness or dying from it, but that they could be another vector that's spreading the disease.
And it gets to be a big deal with school starting. I mean, my kids are going back to school tomorrow. I've got a 12-year-old who's vaccinated and a 10-year-old and 8-year-old who aren't. My wife is who's also a physician and did a lot of work with this and took care of tons and tons of COVID patients. She's going to make the 10 and 8-year-olds wear masks, and they don't want to. And this is going to be something we're all dealing with this year, but it's a big deal. I wish there was something I could do to help people understand how important it is to get vaccinated.
What else can we answer for you? Oh, I really like that, Gina Marie. Thank you. I will answer that live. So if I were you, what would I be asking? This, I would say, ties to what Josh shared at the top of our call. We really appreciate and need you as our advocates, because those rumors and misinformation and misdirection really do great damage. It's very hurtful to the people that are counting on us for accuracy and for care, and it's our honor to do so. So I appreciate there's always the relationships happening behind the scenes, and we have great support from all of you as media partners. But if there are any ways that you can continue to support us in getting the messaging out to all of the audiences that you serve, whether it's vaccinations, whether it's, just COVID overall or anything else that's relevant, please continue to do that, and let us know if there are channels or ways that you're able to reach out into the community that may be of interest to us. We deeply appreciate it because it's helpful. We're all in it to win it together, and you're a partner with us, and we need that. Thank you so much.
Dave Zorn asked the question, are you seeing any other variants around the area besides Delta? It's a great question. It's changed a lot over the last 3 weeks. Delta has been kind of tripling week over week, and it's now over 80%, I think approaching 90+% of the variants are Delta. So because it's replicating and more infectious and spreading quicker than the other variants, that's what we're seeing. There's a little bit of Alpha and some of the other subvariants, but they're minuscule compared to Delta. That's really what we're seeing.
Yeah.
And that should continue to be the case going forward, unless there's a new variant that can outpace Delta.
So people should get vaccinated.
Yeah.
Yes. Have we said that yet on this call?
Yeah.
But kidding aside, one of the reasons we don't hear very much about getting vaccinated is if we can get the community spread down, it allows less new variants to potentially form. So it's yet another reason that community vaccination rate is critical.
Mhm.
So from the conference room, there's a question. Well, I hate to ask the question again, but Dignity Healthcare has required its workforce to get vaccinated. Is it a legal issue? No, it is not a legal issue. This is something that, as Josh mentioned in the intro, we are looking at. And since December, when the vaccine first came out, we told our workforce that while it wasn't required in December, we were encouraging it, and we continue to evaluate that. And that's something that we're using our medical experts and the evidence that's out there to continually evaluate. And we're meeting weekly to discuss this.
Dave asks, we had someone ask us about antibody tests, if those were made more readily available or free. It may get people on the fence to vaccinate. Thoughts? Maybe. I mean, if you're someone who's saying, I've had COVID or I've got COVID antibodies or I don't, so if I don't, I want to go get vaccinated. But here's the deal. Even people who've had it, we still are telling those people to get vaccinated. We're not necessarily sure how effective the antibodies are or how long they last. And all that stuff is still being studied. There's still no reason to not go get the vaccination at that point. the vaccine, we know it works. It's been working. It works in a different way than other vaccines have worked before. It's actually quite amazing, the science that's gone into it, even though it's been around for several years. The vaccine is the bigger answer than getting an antibody test. And if it gets people off the fence, great. But in all reality, those people should just be going to get a vaccine anyway.
It definitely affords additional protection to the natural antibodies from COVID. And the level of antibodies amongst people that have had COVID can be variable. So if you get the vaccine, you're doubling down on your protection for sure.
And I think the big thing also to talk about that, John, I'm sure you'd agree with this. The vaccine's not, in some way, it's about protecting yourself, right? I'm a healthy person who is middle-aged and think I would do fine if I got COVID, and maybe I'd get a little sick and get over it. You don't know that. Sometimes it's worse. You just have to remember the people around you. So the elderly, the children that can't get it, the people who you don't know who are immunocompromised. I'm sure many of us work with people who are immunocompromised and just don't know it because they don't advertise that to us. So once again, it's all about the community getting vaccinated and not just about the individual.
There is a question in the chat. Vaccination rates are low, especially for young people. Will Northern Arizona achieve herd immunity at some point between vaccinated people with antibodies from having COVID-19, or people getting COVID-19 multiple times? Or sorry, second question, are people getting COVID-19 multiple times? I'll take the second one first. You can get COVID more than once. I know people that have. Usually it's a mild infection. The second time around, although I've seen it go the other way where they got a mild infection, probably didn't get very immune and caught it worse the second time. So it can go either way, but it can happen. It's not really common. The second point is, you are going to get herd immunity if you get enough people infected, but that's not the route we want to go. We want to get our herd immunity based on immunization and not infections. So the quicker, easier way and less morbidity to our community is by getting vaccine and not relying on people getting infected to get herd immunity. And as we've seen, even if you have herd immunity, this virus could potentially mutate and still infect people.
There's a question in the chat, John. You and Derek need to take it. What are some of the risks of attaining herd immunity through many people catching the virus?
Well, currently, with how fast Delta is spreading, we don't want to overwhelm resources and the ability to treat folks. So it's in that way, it's different than chickenpox, right? And with chickenpox in the days you invited everybody over, get it over with. But this because it can cause such severe disease, particularly in the vulnerable, that everybody just getting it is not a great option because you'll see many people get sick, end up in the hospital, and you can also get long hauler syndrome. So you can't, COVID-19, you don't
Yeah.
always just get over it. Some people have lingering symptoms that we call long haulers. And so, when people ask me about, well, what are the long-term effects of the vaccine? I say, well, we don't know. That's true. But what we do know is that there's some long-term effects of COVID-19 infections, and those are pretty clear from those that have had it. So that's the main thing I would emphasize, is that not everybody's just going to get it and get over it. Some people might have longer-term symptoms.
Well, and some people are going to die.
Right.
So, I mean, that's herd immunity through everybody getting it means you're going to lose some of the herd. So it's probably not the best plan.
Yep.
And I've seen people with the long hauler syndrome, John. There's some people that I know that got it, and then for several months afterwards were not quite themselves. I don't know how to explain it better than that, but it's definitely something.
We do have a few minutes left. If you've got any last questions that come to mind, put them in the Q&A. Thanks, Stephanie. We see that.
So no, Stephanie, we don't have a long haul clinic. Of course, if someone has been in the hospital and they have had COVID, and the long haul stuff can be weird. I've seen people with neurologic symptoms. I can see people with longer lasting pulmonary symptoms, and you'd handle that in different ways. But we have plenty of follow-up appointments available for people depending on what their issue was in the hospital, but not a specific long hauler COVID clinic. And I would say right now, and John, disagree if you think so. The long hauler syndrome would probably be a diagnosis of exclusion at this point, meaning that we would have to look for other things that could potentially be causing some of the symptoms that somebody has before we could really label them with a COVID long hauler syndrome.
And I just, this is a little bit anecdotal, but I think it's probably going to be something that gets published and is real. But some folks better. So yet another reason in those that have had COVID.
Gina Marie.